हेलो गुड मॉर्निंग। मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के पास्ट ईयर क्वेश्चन पेपर। अ 45-year-old patient present with symptoms of anemia, depigmentation hair, bleeding gums and diffuse hair loss. Which of the following mineral deficiency is most likely associated with this clinical presentation? What the clinical presentation? Anemia, pigmented hair, bleeding gums and diffuse hair loss. Copper, zinc, fluoride or iron. Here the best answer is the copper, because the in the clinical presentation what we says anemia, depigmentation hair, bleeding gums and diffuse hair loss is most consistent with copper deficiency. Copper is a vital trace mineral that plays a significant role in various physiological process including iron metabolism, melanin production, connective tissue formation, and the functioning of the immune system. In the anemia, the copper deficiency is due to the impaired iron metabolism leading to the iron deficiency anemia. In depigmentation here is a result of a decreased melanin production, as copper is a cofactor here for the enzyme, which enzyme tyrosinase, which is essential in melanin synthesis. And bleeding gums and diffuse hair loss is linked with the impaired collagen synthesis, as copper is necessary for the function of lysol oxidase and enzyme involved in the cross linking of collagen and plastin. Next question. A patient with a history of Wilson disease present with neurological manifestation, which of the following is the best diagnostic modality? Serum seroplasmic, urinary copper excretion, hepatic parenchyma demonstration of copper, anti-tissue transglutaminase antibody. Here the best answer is the hepatic parenchyma demonstration of copper, because the Wilson disease is a genetic disorder characterized by the which excessive accumulation of what? Copper in various body or tissue, primarily the liver and the brain. The best diagnostic modality to confirm Wilson disease, especially in the presence of neurological manifestation, is a hepatic parenchymal demonstration of copper. This is usually done by performing a liver biopsy to measure the hepatic copper concentration, which demonstrates the gold standard for diagnosis. Next question. Patient present with large sweaty hands, macroglossia and frontal bossing. Select the best test for confirmation. GnRH, IGF-1, GF2, GH levels after glucose suppression. Here the answer is IGF first. The best diagnosis test for confirming a diagnosis of acromegaly, often caused by the excessive growth hormones, is measuring like insulin like growth hormone first, IGF first. Levels are elevated in IGF first, levels are elevated where in acromegaly due to the increased secretion of growth hormone. IGF first is a stable marker that reflects chronic exposure to the growth hormone and therefore more reliable for diagnosis compared to intermittent measurement of growth hormone. Here the answer. Next question. Patient is having a headache and a confusion of brain tumor. Diagnosis is made. Family history reveals brain and kidney tumors. Choose the correct option. Neurofibromatosis, Lee-Fraser syndrome, VHS syndrome, Church-Strauss syndrome. Here the answer is the, because the headache and confusion, VHS syndrome. Von Hippel-Lindau syndrome is a genetic condition characterized by the development of various tumors, including brain tumors, often hemangioblastoma, kidney tumor, renal cell carcinoma, or other tumors like pheochromocytoma. The family history of both brain and kidney tumors and align with VHS syndrome. This condition is due to mutation of the VHL gene. Next question. Patient present with feature of right heart failure and exhibit a rapid wide descent on cardiac ejectness. What is the most likely diagnosis? Constructive pericarditis, cardiac tamponade, pulmonary hypertension, right ventricular infarction. Here the answer is the constructive pericarditis, because the constructive pericarditis is a condition where the pericardium becomes thickened and fibrotic. Thickened and fibrotic. Thickened and fibrotic, leading to impaired feeling of the heart, particularly the right side. A rapid wide descent on jugulovenous pressure (JVP) is a classic finding is constructive pericarditis, reflecting rapid early diastolic filling of the ventricles due to the rigid pericardium. The patient may present with sign of right heart failure such as peripheral edema, ascites, and hepatomegaly. Next question. A pulmonary artery hypertension patient presented with an irregular pulse. See the point. Loud P2 on auscultation. Which JVP finding will be seen in the patient? Absent A wave, canon A wave, rapid X descent, rapid Y descent. Rapid Y descent is the here the correct option is the absent A waves. Loud P2 irregular, and the patient here the patient has pulmonary artery what hypertension PH, and patient presents the what irregular pulse with loud P2. Loud P2 means second heart sound. Loud P2 ये क्या है? Second heart sound है. The irregular pulse suggests the presence of atrial fibrillation, which is often associated with the PAH. What PAH means? Pulmonary artery hypertension. Due to the which right arterial enlargement from increased the pressure. Next question. Patient present with a recurrent lung infection and chest XR is given below. What is the most likely diagnosis? Cut-Angle syndrome, cystic fibrosis, Georgia syndrome, and Down syndrome. C. The X-ray. Here the option is the for Cartagena syndrome, because the Cartagena syndrome is characteristic of a triad of what? Situs invertus, dystocardia, seen on chest X-ray, chronic ascites and bronchiectasis. The recurrent lung infection in this case are consistent with the chronic respiratory issues seen in Cartagena syndrome. The dystocardia noted here in and the chest XR is supported this diagnosis. That's all, and keep revising.